Tests done to 8 p.m. yesterday, another bumper day. Thank you for everybody who's come forward to get tested. We had, unfortunately, 390 cases of community transmission. Some are still under investigation, but at least 60 of those have been infectious in the community. And I anticipate, given the large number of cases we've had in the last few days, that unfortunately this trend will continue for at least the next few days. So it means all of us have to work harder to make sure we stay at home and follow the rules. Tragically, 2 people lost their lives overnight because of COVID. One woman in her 40s in southwestern Sydney who died at home tragically. She wasn't vaccinated, and we extend our heartfelt condolences to her loved ones and extended family. There was also the tragic death of a man in his late 90s in the Hunter, New England area. He was vaccinated but also under palliative care. Again, our heartfelt sympathies and condolences. I know that every day when we read the statistics about the deaths, we often remember or don't remember that behind every single statistic is a loved one, a family, and many carers. So we extend our heartfelt thoughts to all of them. The main challenges remain Western Sydney and southwestern Sydney, and whilst again we've seen ongoing stabilisation in Fairfield and Canterbury-Bankstown still has the highest number of cases, but we have seen stabilisation and the cases aren't growing the way they were in the last few weeks, which is a positive. But the health experts have asked me to highlight Blacktown and Mount Druitt as areas of concern and adjoining areas. So we're really wanting to make sure that people living in Blacktown and Mount Druitt and those adjoining suburbs come forward for testing, stay home, and if they haven't already got vaccinated and they don't have symptoms, to come forward and get vaccinated. Unfortunately, also around the Dubbo region, Dubbo in Western New South Wales is becoming a big challenge health-wise with 25 cases overnight. And of course, the New South Wales government has been liaising with our federal colleagues as well to make sure we get support to those communities in Western New South Wales and far Western New South Wales. And anything we may need to do further in that area is being considered during the day today. Hunter, New England had 5 additional cases, which is an improvement of the last few days. However, pleasingly, Tamworth, Armidale and Northern Rivers had no cases, which is pleasing. However, obviously, we're not out of the woods in those areas given there were those exposure sites. In relation to vaccines, thank you to the 105,000 people who got jabbed yesterday. That's an outstanding result. Pleasingly, by the end of today, 15,000 HSC students would have received the jab, so again a very pleasing result. In 5 days we've done 15,000 HSC students, and I want to thank them all for coming forward and getting the jab. It means they can sit safely for their examinations later in the year. This Sunday we have a bumper day of vaccinations for tradies and construction workers. There's already around 10,000 people who've booked throughout those locations, and I just want to stress that the one location in Prairie Wood will maintain its status as a walk-in centre. So if you're a tradie or a construction worker, you haven't already got a jab and you haven't booked anywhere or won't be booking by that day, you can walk into the Prairie Wood Centre and get the jab as well. And that's pleasing that the construction sector and tradies have been very enthusiastic about coming forward and getting the jab, and certainly getting back to work safely has been an incentive for that group of workers. Pleasingly, from Monday next week, 100,000 authorised workers aged between 16 and 39 years of age in those local area governments of concern in Greater Sydney will be getting a jab. So through their workplaces and through other points of contact, they'll be sent invitations. So over and above what we're doing already, 100,000 authorised workers, and we know that workplaces and households remain and continue to be the greatest source of infection. We know there's categories of workers that just can't stay at home because of the important work they do, whether it's in healthcare, whether it's in getting food on our table. They must work, and knowing that they're going to get vaccinated gives us that greater degree of confidence in trying to reduce the spread, but also in making sure people stay out of hospital, and that's what we need to ensure. Please know that by following the rules and getting vaccinated, you are making sure that you keep yourself and your loved ones safe, and it's really, really important that if you haven't had the vaccine, please consider getting it to make sure that you stay safe, you stay out of hospital, but also that we do everything we can to reduce the spread. I also wanted to highlight to the community, given National Cabinet's meeting today, that according to the Doherty report, which the New South Wales government supports, once you get to 70% double doses, it triggers certain conditions, and of course once you get to 80% of your adult population on double doses, that means obviously that communities start to live with COVID in a real and meaningful way. So on current projections, conservatively, New South Wales will get to 70% double doses by the end of October, and by mid-November we hope to get to 80% double doses, and of course I'm looking forward to those 6 million jabs occurring by the end of August, and so far we're doing very well. I think we're up to 4.7 million or 4.8 million by the end of today in terms of jabs. Hopefully we'll get to 5 million early next week, and then the sprint towards 6 million by the end of August, and we're looking forward to hitting those milestones, because we know the more of us, the higher percentage of us that are vaccinated, the greater opportunities we have in the future, and the greater opportunities we have to live more freely and safely. So I'll now ask Dr. Marianne Gale to give the health update. Deputy Commissioner Willing will talk about some police operations, and then we'll take some questions. Thank you.
Thank you, Premier, and good morning, everyone. There were 390 locally acquired cases of COVID-19 reported in New South Wales to 8 p.m. last night, and one overseas case. There were almost 130,000 tests reported to 8 p.m. last night. So again, a big thank you to all the community for coming out to get tested. And again, an all-important reminder that even with the mildest of symptoms, we ask you to please come forward to get tested, and continue to do so in the great numbers that you are. In terms of COVID-19 cases in hospital, there are currently 391 cases admitted to hospital, 63 cases are in intensive care, and 30 require ventilation. Of the 63 in ICU, 4 are in their 20s, 6 are in their 30s, 5 in their 40s, and 15 are in their 50s. And I just want to emphasise, I guess again, to people the importance, particularly for young people in our community. With this Delta variant, we are seeing a large number of younger adults being affected by COVID-19. In the last 14 days, that 20 to 29-year-old age group we have seen being the biggest numbers. And so I just want to particularly encourage younger adults in our community to please take the stay-at-home orders in the Greater Sydney area as seriously as you possibly can. Please follow the advice, please get tested, please get vaccinated. Of the 63 people who are in ICU, 55 are not vaccinated. As the Premier mentioned, we're very sad to be notified that 2 cases of COVID diagnosed died overnight. The first is a man in his late 90s from Newcastle who died at Hawkins Masonic Village in Edgeworth. He had acquired his infection recently as part of the outbreak in the facility. He had received 2 doses of vaccine, and our heartfelt sympathies go out to that family at this time. The second death notified was a woman in her 40s who died at home in southwestern Sydney. She was a close contact of another confirmed case. She tested positive on August 7th and was unvaccinated, and the local health district will be investigating her death and also be referring it to the coroner. And again, our sincere, heartfelt condolences to her family. I'd like to provide a brief update on Western New South Wales. Overnight we had 10 new cases identified in the Western New South Wales Local Health District, the majority being in Dubbo and 2 in Walgett. It is an evolving situation in Western New South Wales that we are carefully monitoring, and we do expect to see some further cases emerge. In the sewage detection, there has been COVID-19 detected in the Bathurst region, Parkes and Burke, and so we encourage all the community in Western New South Wales to please note the stay-at-home orders, stay within your household, don't go out only for reasonable excuses, please seek testing and please get vaccinated as soon as you have an opportunity to do so. In Hunter, New England, there were 5 cases notified overnight. 1 is an additional case associated with the residential aged care facility, and the 4 other cases are those linked to previously reported cases. And finally, just to emphasise, as the Premier did earlier, we'd like to encourage people who live in the Blacktown area and Mount Druitt area as well to please follow the stay-at-home order and please come forward for testing if you have even the mildest of symptoms. Thank you.
Good morning, Premier, Minister. Good morning, ladies and gentlemen. In the last 24 hours, 404 infringement notices have been issued and 41 people charged with breaches of the public health order. It's simply unbelievable at this point in the current crisis that people are still flouting the rules. I can indicate that, as you're aware, yesterday a 19-year-old Rose Bay man was charged with breaching the public health order by travelling to the Byron Bay area. A 52-year-old man remains before the courts in relation to the same matters. I can indicate this morning that overnight a 21-year-old female and a 20-year-old female were charged with breaching the public health orders by travelling to the Newcastle area around 2 weeks ago. Police will be alleging that both of those women have a history of non-compliance with the public health orders. And I've got to say that people travelling to regional areas from Greater Sydney are putting regional communities at risk. If we don't catch you during our compliance operations, which is highly likely given the amount of resources that are out there on our roads and in our communities trying to find people in breach of public health orders, we will do so through our investigations. Just overnight, police responded to 1,100 odd Crime Stoppers reports. All of those spark investigations. Now, in saying that, I'd like to thank the people who are abiding by the current health orders. In the last 24 hours alone, police have conducted over 1,800 welfare compliance checks, checking on over 3,000 people. And the advice that I've received this morning is that all of those people were in compliance with the public health orders. So thank you to those people. And I just want to reiterate too that emergency management arrangements in the form of local emergency management committees and regional emergency management committees are up and running across the state of New South Wales to support people through this difficult period. In regional New South Wales, particularly in the far west of the state, those arrangements include specific action plans that have been developed with input from local communities and tailored to local communities out there to help them through this current difficult period. So thank you very much.